Good day, everyone. My name is Jerry Castro, your co-host for the Carib Central, and my co-host
Melanie Bates.
and we're here live from Baytown for the CAHFT first annual Community Health Fair.
Morning and welcome to our first annual Caribbean Community Health Fair in Baytown. This again is in conjunction with the Calvary Worship Center. We are very, very excited that you're here today. It's been a pleasure. It's been a project, and it's really been a pleasure that we've been working on, and we thank the Calvary Worship Center group and staff for just welcoming us to this wonderful venue and just being so very supportive. We've got a lot of exciting things in store for you today, but before we even start explaining those to you, I would love for Pastor Bruce to come up and do the invocation. So Pastor Bruce, if you would kindly come and welcome us, please. Thank you.
You know, the Bible says my people are destroyed for lack of knowledge. And that's why I think that I'm such a big believer in this health fair. Don't be afraid to get checked. Don't be afraid to look at things, because faith in God is not afraid of facts. So go ahead and get the facts and find out if there are any issues with your health, and then go to God, and then go to the doctor, and God's going to take care of it. Doctors are going to take care of it, and medicine and God together will work, and you're going to come out of whatever health issue you may be having. Heavenly Father, we thank you today for the preciousness of your grace, your mercy, and your love for us. We know, Father, that we are body, soul, and spirit. We know, Father, that Jesus Christ died on the cross that we may have eternal life. But Lord, before we receive that blessing of living forever, we have to live here on earth for a while first. And we ask you, Father, to touch our minds, our bodies, our spirits. A merry heart doeth good like a medicine. Help us, Father, to not be afraid, not to let fear and phobia to linger in our life, but help us, Father, to understand what is going on with the changes of our ages, the changes of our bodies, the changes of our nutrition, so that we can be the very best temple of the Holy Spirit that you have called us to be. Now, Father, put your blessing on this great health fair today, all the participants, all the vendors, all the workers, in Jesus' name. Amen. Thank you so much for being here.
Thank you, Pastor Bruce, for this wonderful invocation. At this time, if you would kindly go to the back and visit with the vendors. We're just going to wait just a few more minutes, and we're going to have our first speaker within 5 minutes. Okay, so if you'll just walk back. Part of the things we've got scheduled for you is we've got the topics today: Crisis Pregnancy Center. Hannah Medley will be speaking. We have diabetes with Avril Greenidge, stroke-related issues with Nathalie Dorsett, prostate cancer, Tina Medard, breast cancer, Michelle Stephenson, and asthma, Stacy Alfred. So as you can tell, we've got a wide range of different topics that may not affect you individually, but it may affect someone in your family. It may affect a friend. And I know those topics that I just mentioned, someone can identify with at least one of those topics. So we're also going to have on-site testing for blood pressure and glucose testing. So we're going to have we've got 2 tables in the back that we've got 2 nurses that have, really being really gracious enough to do on-site testings for us. So there's going to be a lot planned for you today. We also have in the back, we've got a couple of vendors that should be setting up shortly. We've got some fresh fruit, and we have water that you can have if you feel like you're a little thirsty. Just let us know, and we'd be more than happy to guide you to that area. But in the meantime, give us 5 minutes. You can walk around and take a look at the vendors. Please visit with them. There's a lot of literature on those tables that you can take a look at, and that may be of benefit to you or someone that you know. You might be able to take it home with you. Okay, so thank you so much, and see you within 5 minutes.
Hello everyone, this is Judith Soto, and you're watching CAHFT on CAHFT TV.
Hi, so we're back here at the CAHFT First Annual Community Health Fair with my co-host, Melanie Bates. Mel, if you don't mind me calling you that, good morning, good afternoon,
Good morning.
good day, and tell us briefly, how do you feel about being in here at such an important event
Oh, wow. It's such a beautiful day outside, such a wonderful day for people to come out and really get some information on their health. There's so many different topics. They have diabetes, breast cancer, asthma, so many great things for people in our community to learn about.
And it's specifically interesting given the fact that, today we're starting off with the National Breast Cancer Awareness Month.
Yes.
And it's very important for our community to sort of like know about what's happening here and, of course, how to get yourself checked out for, on health prevention and education. We've noticed that there's so many vendors out there,
So many.
a lot of experts who are going to help us out this afternoon
Right.
in letting us know what's happening and how to get yourself tested and all that good stuff.
Right. The issues for our community, there's so many different topics and different health diseases. We have so many people here who are willing to help, and you don't know until you get tested. I think that's very important. You have to have the information you need to go ahead and get tested, and we have that here today.
Well, it's such an amazing thing. But before we go on, we definitely want to give a tremendous shout out and commend the work of the staff and everyone who are here today, especially Calvary Worship Center, the pastor who came out and did the great invocation today to kick off the first annual health fair. The people here over in Baytown, everyone, the vendors, the food that we're going to have later
wow,
on,
yes.
healthy food, because we
Healthy.
have to maintain that, to sort of like make sure that at the end of the day, we're going to we'll be back in a few moments. Tenemos muchas personas allá atrás que los vendedores y los expertos que nos van a ayudar a básicamente hablar en breve acerca del evento de hoy. Bueno, for myself and of course Melanie, we'll be right back and have you guys meet the speakers and of course have a little discussion about the important topics of today. And big shout out again to, of course, our chairman who's behind the cameras as usual, and the president, Lucia Bates, who literally alongside with the volunteers and helpers to put this event together. She organized to put this event together, but we'll be right back, and definitely we'll be right back.
This is Melanie with CAHFT on CAHFT TV.
We welcome you to our first annual community health fair. We really thank you for coming, especially it being a Saturday morning. I know that a lot of you wanted to sleep in, and there are lots of other things that you could be doing, but you decided to come out because we've got some extremely valuable information that we'd like to share with you. And so we feel very blessed that you were able to take your time out and come here for this wonderful event. Our first speaker today would be from the Crisis Pregnancy Center. We've got Ms. Hannah Medley. Did I say that correct? Thank you. If you'll kindly give her a hand.
Well, y'all get to be my guinea pigs because this is my first time to speak for the Pregnancy Center. If you have a lot of questions, I can try to answer as much as we can, but I'll try to give y'all just general information about what our center offers. First off, we are a Christian-based center. We offer parenting classes and any kind of things that do with parenting. Any kind of items the parent might need for the child, we help to supply those. They can earn mommy dollars in our HOPE program, and they're able to buy everything they need up to 1 year old for the child. Up until the child is 1 year old, the mother and the father can come to our center and earn mommy dollars. And also they have resources at our center for adoption options. If they come into our center and the pregnancy is unplanned, we have different options for them to go and speak to adoption counselors and stuff at other organizations. We can refer them. And we also offer abortion alternatives. That is that we give them options other than abortion. If the child is unplanned and the mother is abortion vulnerable, then we give them options other than have an abortion. And also, we are part of something called the Christian Agency for Pregnancy and Adoption, and our center offers pregnancy tests, ultrasounds, parenting classes, and also peer counselors. And if there's anybody here today that's interested in coming to our center and being a volunteer, we always need peer counselors. The center here in Baytown has helped 745 women just this year. Well, in 2010, we have our statistics for 2010. And of those 745 women, we were able to share the gospel with 665 of them. If the lady comes in and she doesn't want to hear the gospel, we do not pressure her. Even though we are a ministry-based business, we do not pressure her. We're there to help. And that's with all the ladies. If the ladies come in and they have had an abortion in their past and they are unable to get over that, we have an abortion healing class that we give a couple times a year. We have a lady that is called into that ministry, and her name is Tracy, and she does that ministry for us. And 70% of the women we have or that have abortions claim some kind of Christian affiliation. And 1 in 3 women will have an abortion in their lifetime. And it's after that's over that usually they have an emotional problem with that. I believe it's called PSA, and it's post-abortive abortion syndrome, and it's a form of traumatic stress disorder. And it usually happens in teenagers, women who have already had children that find that they don't or can't afford to have another child, so they end up having abortion in hopes that, that they don't put stress on the rest of their family. And women who are pressured into having abortion, and women who struggle with value conflicts. Sometimes a Christian lady will have pressure to have an abortion when she doesn't want to, and later on she has to deal with that, and she deals with the guilt. And we have this class to help people realize that God does forgive and that she can get past that point in her life. We also have a HOPE program, and we offer parenting classes and prenatal classes and nutrition classes. We also do a Bible study for the girls that come to our center. A lot of the girls aren't part of a Christian family, and a lot of the girls do not have any support at home for their pregnancy. So these girls can come to our center, and all of our services are free. We give them the pregnancy test, we confirm the pregnancy, and they can start immediately coming to our classes and getting mommy dollars. And they earn the mommy dollars by doing homework or reading pamphlets and reading the books about their child. And when they get the mommy dollars, they can come to our HOPE program store and buy everything they need for that child. We also have a resale shop now in Baytown, and they can also spend their mommy dollars at the resale shop. They can get maternity clothes, diapers, formula, baby bottles, baby clothes, and we even have ladies in the community that knit and crochet blankets and stuff, so they can get all these items for their babies. And also their husbands or maid or parent, whoever's closest to them that's helping them with the child, can come and help them to earn mommy dollars. There's one other thing I wanted to mention. Our pregnancy center is funded by our ministries in Baytown. The majority of the companies, Christian companies and Christian ministries here in Baytown fund our organization. But we do have a few large fundraisers that we do each year. And our largest fundraiser this year is at the Spring Hill Marriott in Baytown next to Cracker Barrel. We're having a lady by the name of Abby Johnson come and speak. Abby was a director of Planned Parenthood. How many of y'all have heard on the news about Planned Parenthood and all their issues and shutting down and not getting their fundraising or not getting their funds anymore? Planned Parenthood has a lot of good things about them, but they also are an abortion facility. They say they're family planning, but they have a lot of abortions go through their facility. And of course, we try to save all of the lives that we can. And Abby was the director at Planned Parenthood for 8 years. And when she was part of an abortion, or when she was in the room with an abortion happening, she made a drastic change in her life, and she walked out of the room, walked across the street, and joined 40 Days of Life. And so she's coming to be our speaker for our annual fundraising benefit. And she's going to be here on November 1st at the Spring Hill Marriott. And the tickets are on sale now, and you can go to our website at Baytown, PRCE, and you can find out more information about it. But she's going to be here November 1st. We're going to have a silent auction, a meal, and we're also going to have our speaker, and that's our major fundraiser for the year. We also have a craft sale coming up in March. I'm the event coordinator, so I know about all the fun stuff that we do. And the craft sale's coming up in March, so we'll need vendors and people to come out in the community. And hopefully this year we're going to have a lot of kids stuff, moonwalks and popcorn and Cokes and all that kind of stuff to encourage people to find out more information about us. So that's kind of us in about 10 minutes. So do we have any questions, or anybody want to ask any questions? We're there if y'all need us. All our things are free. We're located at 3013 North Main, right across from the police station. Oh, yes. All of our services are confidential. That's an important topic. We cannot give out any, no matter the age of the child or the age of the young lady that might have a pregnancy, we do not give out that information to anybody. All services are free and all services are confidential. So, enjoy y'all's day at the health fair. And I guess we're ready for the next one.
Thank you so much, Hannah. We really do appreciate the information that you shared with us. This is very valuable information. This may not affect you personally, but you may know someone. Everyone is in, close proximity to a teenager or someone who may have gotten themselves in trouble, without it being planned. And so these are resources. So I encourage you to go to the back when we have our break and get with Hannah. She'd be more than happy to give you the information. So it might be something that you can pass on to someone else. So again, thank you so much, Hannah, for coming out. At this time, we will talk about another, I think, extremely important topic that affects just about every household. Everyone knows of someone who has diabetes or have had diabetes. So we've got Miss Avril Greenidge. Did I pronounce that correctly? Thank you. We'll have her come up and talk with you, give you a little information. Thank you, Avril.
Good morning. As Lucia said, my name is Avril, and I would like to welcome you to CAHFT's first annual Community Health Fair. I appreciate your time and your attention, and this topic has a lot of facets to it, so bear with me when I go through all of this information. I'd like to ask for a few minutes of your time that we may discuss the topic of diabetes, which is often referred to as sugar. Diabetes has many aspects to it. It can affect persons of any race, gender, or age. It is a great idea to be screened for diabetes as a general rule, because many times people have diabetes and are not aware of its presence. Diabetes is a disease that can lead or predispose a person to other diseases or complications. The good news is early detection and control of diabetes can allow individuals to live well and have a healthy life. According to the American Diabetes Association, diabetes is a disease in which the body does not produce or properly use insulin. Well, you might ask, what is insulin? Insulin is a hormone that is needed for the body to convert sugar, starches, and other food into energy that we need for our daily life. Types of diabetes. There is type 1 diabetes, which used to be called insulin-dependent diabetes. In this instance, a person's body does not produce any insulin at all. Type 1 diabetes most often occurs in children and young adults. These individuals require insulin on a daily basis to stay alive. There's prediabetes. This is when a person's blood glucose levels are higher than normal, but not high enough for a diagnosis of diabetes. In this state, there must be some lifestyle changes in an attempt to gain control of blood sugar levels and delay or avoid type 2 diabetes. According to the ADA, studies have shown that up to 58% of people with prediabetes can delay or avoid type 2 diabetes altogether. Type 2 diabetes was formerly known as non-insulin dependent diabetes, which results from the body's inability to make enough insulin or properly use the insulin it makes. It is the most common form of diabetes. Gestational diabetes, what does this mean? Pregnant women who never had diabetes before, but they have had high blood sugar levels during pregnancy are said to have gestational diabetes. During pregnancy, the mother's body is not able to make and use all the insulin her body needs for the pregnancy. Glucose levels build up in the blood to high levels and, if untreated, can cause harm to the baby. Data from the National Diabetes Fact Sheet that was released on January 26, 2011, addresses the prevalence of diabetes. It says 25.8 million children and adults in the United States, which is 8.3% of the population, have diabetes. That's an astounding number. 18.8 million have been diagnosed. 7 million have not been diagnosed. 79 million have prediabetes. In 2010, 1.9 million new cases of diabetes were diagnosed in people 20 years of age and older. Diabetes is more common in African Americans, Latinos, American Indians, Asian Americans, and Pacific Islanders. What about prevalence of diabetes in people from the Caribbean? This is the CAHFT, Caribbean American Heritage. I took the liberty of finding out some information about that. Caribbean societies appear to be at substantial risk of diabetes. According to the Pan American Health Organization, in the year 2000, the number of people who suffered from diabetes in the Americas was an estimated 35 million, of which 19 million lived in Latin America and the Caribbean. The PAHO projects that by the year 2025, the number will increase to 64 million, and that 40 million of those persons will live in Latin America and the Caribbean. Risk factors. Persons at risk for diabetes. Those that I already mentioned, African Americans, Latinos, and those that are overweight, that do not exercise regularly. Persons having a family history of diabetes, whether it's a sibling that has type 1 or a parent that has type 2, or women who have had gestational diabetes. Complications. Diabetes, if not detected or if it is uncontrolled, can lead to complications or serious health problems. I must mention here that many people with diabetes are able to prevent or delay the onset of complications. Diabetes can affect a person's eyes, glaucoma, cataracts, a person's skin, boils and different kind of skin infections, the heart. Uncontrolled sugar predisposes a person to heart disease. Let me get that out. Hypertension, which raises your risk for heart attack, strokes, and kidney disease. Stress. Blood sugar levels that increase during stress can cause a person to have uncontrolled sugar. So it's important to get a handle of any stress that you may know of in your life. The mouth. Diabetes predisposes a person to gum disease. This increases as the risk of diabetes as a person, how do I put this? It's the risk for gum disease increases with uncontrolled sugars. Hearing in kidneys and the feet, which is a big part. A lot of people talk about their feet having no feeling, numbness. It's called neuropathy. When people that have diabetes can easily cut their feet, step on things and not be aware that they've injured themselves because there is numbness and nerve damage in their feet. So that's something that diabetics must pay particular attention to. Now, allow me to take a moment to encourage you to remember many of these complications can be avoided and prevented. Signs and symptoms of high blood sugar. Person's very thirsty, very hungry, very sleepy. They have blurry vision. They need to urinate more often than usual. They may have dry skin, and they may have injuries or infections that take a long time to heal. I would like to point out some resources in the community. San Jacinto Hospital has a diabetes education program that hosts diabetic teaching once a month, and it is free to the public. The American Diabetic Association.org, that's where I got this test from. That's where some of the papers, the handouts on the back table, is where a lot of the resources came from this organization. And then the American Dietetic Association. There's been changes within the last year or so as far as portion sizes. Let me put that out. Remember, it used to be the pyramid once upon a time. Anybody remember that it was a pyramid? Now it's the plate, which is more, we can relate more to the plate than the pyramid. And there's some handouts in the back that talk about what should be included on your plate, okay? In closing, November is Diabetes Month, and beginning November 1st, the ADA is asking individuals to take a pledge and raise their hand to stop diabetes. Thank yous. I'd like to thank Lucia Bates and CAHFT for this initiative, San Jacinto San Jacinto Diabetes Education Department for printed materials and door prizes, Calvary Worship Center, and those in attendance for your time and attention.
We want to thank again Crisis Pregnancy Center, Hannah Medley, for giving us such wonderful information on crisis pregnancy. We also would like to say thank you again to Avril Greenidge with the Methodist Hospital for giving us again wonderful information on diabetes. At this time, we would like to have Miss Nathalie Dorsett with the Methodist Hospital come and talk to us about some stroke-related issues. Again, this is another topic that is near and dear to a lot of our hearts, and if you have not had any of those symptoms or any of those diseases, you may know of someone who does. So be sure to give her a warm welcome. And Nathalie, thank you.
Hi, thank you, Lucia. Good morning. My name is Nathalie Dorsett, and I'm a registered nurse at San Jacinto Methodist Hospital. I've been a registered nurse for 34 years, and I have been working here in Baytown for the past 22 years. I have a passion for stroke because my mother had a stroke when she was 74. It did not leave her debilitated, but it left her with loss of some functions. Can you tell me the last time that you visited your doctor or a doctor, or the last time that you took someone to the doctor? Those people who have been to a doctor recently stand a better chance at survival than those who have not. According to the American Heart Association, stroke is the third leading cause of death in the United States and one of the major leading causes of disability among African Americans. Also, according to the National Stroke Association, 1/2 of all African Americans will die from stroke or heart disease. African Americans are twice likely to die from stroke as Caucasians. They are more likely to become disabled and experience difficulties with daily living and activities. On average, someone suffers from stroke every 40 seconds. That is less than 1 minute. Previously, it was every 53 seconds. That number is getting lower and lower every year. Do you know why? It is because we are not taking care of ourselves. We are not going to the doctor. We are not taking our medication as prescribed. We are just not making any attempt to change our daily lifestyle. About 795,000 Americans suffer each year from stroke. Previously, it was 600,000. Approximately 610,000 are first attacks. About 4 million Americans are stroke survivors. Every 3 to 4 minutes, someone dies of a stroke. Stroke is the leading cause of long-term disability. The estimated direct and indirect cost of stroke for 2009 was $68.9 billion. Previously, it was $30 to $40 billion a year. The average American cannot afford that. The cost of hospitalization continues to rise, and Medicare and most insurance reimbursement are capped, which leaves you, the stroke survivor, with a high hospital bill. What are the causes of stroke? There are several causes. Some of them can be modified or prevented, and some cannot be modified. The factors that can be modified are high blood pressure. High blood pressure is the #1 risk factor for stroke. 1 in 3 African Americans suffer from high blood pressure. The next factor is diabetes. Diabetes is #2 risk factor for stroke. Carotid artery disease. Your carotid artery is that blood vessel in your neck that takes blood to your brain. High cholesterol. Atrial fibrillation. Atrial fibrillation is when the top part of your heart, when it quivers. This is called atrial fibrillation. Cigarette smoking. Excessive alcohol use. Physical inactivity and stress. Stress is the key tool to a lot of diseases. Not only does it cause stroke, it also causes diabetes, it causes cancer, and it also causes ulcer in your stomach. The non-modifiable risk, or those that you cannot change, are age, race, gender, genetics, and family history. Sickle cell anemia is the 3rd highest risk for stroke in Black people. There are different types of strokes, and they present differently. The first type of stroke is called ischemic stroke. This means that the brain tissue is dead. It accounts for 87% of all strokes. This normally results from a clot in the blood vessel that carries blood to the brain. When this happens, the brain is deprived of oxygen and glucose. This leads to cell death or brain death. Prevention of cell death can be averted or prevented if treatment is received within the first few hours of a stroke onset. The second type of stroke is caused by bleeding. It is called hemorrhagic stroke. This accounts for 13% of all strokes. In most cases, this is caused by high blood pressure. When your blood pressure is high, it causes the blood vessels that carry oxygen to the brain to bulge, and eventually this ruptures, causing blood to leak into the brain tissue. This normally is treated by surgical intervention and the prognosis is poor. The third type is called transient ischemic attack, or TIA, as you might heard this word. In this type of stroke, a blood clot temporarily blocks the blood vessel that carries oxygen to the brain. The symptoms normally last up to or less than 24 hours. Approximately 15% of all strokes are preceded by TIA. What are the signs and symptoms of stroke? The first one is altered mental status. What does that mean? It means that someone who is no longer exhibiting normal functions. They are no longer alert. They do not know their names. They appear to be confused. They are mumbling. They are falling in and out of consciousness. When you see those signs, this means that the person is having a bleed. The second one is nausea and vomiting. This is also a sign of a hemorrhagic stroke. The third one is headache, loss of vision or double vision. One side of the face is drooping or not even, numbness of an arm or a leg or both, paralysis of one side of the body or both sides of the body, vertigo or dizziness, walking unsteadily, and inability to talk. It is very important to exclude other conditions with stroke-like symptoms. Example, low blood sugar. When someone has a low blood sugar, they appear to be confused and mumbling. So when a patient is presented to the emergency room, the first thing that is done is to check the blood sugar to rule out low blood sugar. The next one is migraine and seizures. Seizures is normally a sign of stroke. Research supports that early recognition of stroke symptoms and early treatment improves the chance of recovery, and minimizes deficits. For every minute delay in treatment, the brain loses 1.9 million neurons or brain cells, 14 synapses. The synapses is the tail of the cell that carries the messages from one cell to another, and 7.5 millions of fibers. Therefore, time lost is brain lost. What should you do if you or your loved one display the symptoms of a stroke? Call 911 immediately. Do not take the time and drive yourself to the emergency room or have your family member drive yourself to the emergency room. Call 911. The paramedics are trained in caring for stroke patients. Many hospitals receive stroke center certification. What does that mean? That means that they have the resources and personnel to take care of you and make exceptional efforts to foster better outcomes for stroke care. San Jacinto Methodist is a primary stroke center. It has been for the past 5 years and received several awards from American Heart Association and other governing bodies for the successes it has had with stroke care. If you are having symptoms of a stroke and you have called for an ambulance, the paramedics will call ahead and inform the emergency department that they are bringing in a patient with a stroke. The emergency department will activate the stroke team. The stroke team consists of a neurologist, radiologist, the emergency room physician, emergency room nurses, the EKG technician, a lab technician, a pharmacist, the ICU charge nurse, the admit nurse, and other significant persons. Whether the patient walks in with stroke symptoms or comes in by ambulance, the process remains the same. A CAT scan, which is a special X-ray, of your brain, is done immediately to determine the type of stroke. If the onset of the symptoms occurred less than 3 hours and the patient does not have any contraindication to specific medication, the patient is given a medication through an IV that dissolves the clot and stops the progression of the stroke. This medication is called TPA, or tissue plasminogen activator, or clotbuster, as you may have heard. This was the first drug approved by the Food and Drug Administration for the treatment of an ischemic stroke. The chance for survival is very high with this medication. Symptoms normally resolve within 24 hours, and the patient no longer has the symptoms of a stroke. Approximately 25% of patients worsen in the first 24 hours following a stroke. This is normally due to the brain swelling. That is why time lost in seeking care is brain lost. The goal of stroke centers is to maintain life support, restore or maintain cerebral perfusion, that means blood flow to the brain, restore fluid and electrolyte balance, preserve your motor, speech, and cognitive functions, and prevent complication. There are several factors that cause delay in seeking care. Most strokes occur while sleeping and are not discovered until the person wakes up. Strokes leave some patients too incapacitated to call for help. Occasionally, stroke goes unrecognized by patients and their caregivers. What can you do to prevent a stroke from occurring? You have to go through a lifestyle change. Have yearly physicals. Take your loved one to the doctor. Take your medication for high blood pressure if you've been diagnosed with high blood pressure. Take your medication to reduce your blood cholesterol. Eat food low in cholesterol and high in fiber. Exercise daily. Stop smoking. Stop excessive use of alcohol. Reduce stress in your life. Keep your blood sugar at a normal level. And take an aspirin a day. All you need is just a little bitty aspirin. It's 81 milligrams. And that alone can prevent you from not only having a stroke, but also it can prevent you from having a heart attack. If you have a history of atrial fibrillation, make sure you're taking your anticoagulants. Anticoagulants is a medication that prevents the blood from clotting. Every time the heart fibrillates or quivers, it sends little blood clots to the brain that eventually leads to a stroke. You are 5 times more liable to have a stroke from atrial fibrillation. Taking your anticoagulants will prevent that from happening. Remember, prevention is always better than cure. Stroke is an emergency. Every minute counts. Therefore, act fast. Fast means F is for facial drooping or uneven smile. Arm is for arm numbness. S is for slurred speech or difficulty in speaking or understanding. T is for time. Time for you to call 911 and get to the hospital immediately. March is Stroke Month. The Methodist Hospital has a walk for stroke every year in March. This year we had the highest attendance. So I hope to see you at Rice University next year. Thank you.
Hello, good afternoon, everybody. I'm also a nurse at San Jacinto, and I work in the cancer area. The prostate cancer is something that's really dear to me because my father is a prostate cancer survivor. Your prostate is located between the rectum and the bladder, and the normal size of a prostate is the size of a walnut. Whenever it starts to grow larger, it'll squeeze your urethra, which is the tube where the urine flows, and this can cause the urine to slow down. The prostate gland is also the gland that carries sperm in the body, and it also produces some male hormones. Risk factors with prostate include being over 65 years of age. Your risk of catching prostate cancer does increase as you get older. You can get it under 65, but it is rare in men that are under 45. Also, if you have a family history of prostate cancer. Race is another risk factor. It is common amongst African American men, but is less common in Pacific Islander men and American Indian and Native Alaskan men. Just because you have those risk factors doesn't mean necessarily that you will contract the disease, but you want to be extra careful. Some symptoms of prostate cancer include difficulty urinating or having trouble starting your urine flow, also having a weak flow or frequent urination at nighttime, and pain during urination, or difficulty with erection, or when you notice blood in your urine and sputum. Also, frequent pain in the lower back, hips, and upper thighs. If you do have those symptoms, it's not always necessarily prostate cancer. There's also an infection known as benign prostate hypertrophy, which is also meaning your prostate still did grow, but it was just an infection. It wasn't the cancer. Ways of diagnosing the cancer: your physician may perform a digital rectal exam where they go in through the rectum to press against the prostate. There's also a test called a PSA where they look to see the levels. If you have a high PSA, it could mean that you have the prostate cancer, or it could mean that you have the BPH, which I mentioned earlier. There's also an ultrasound that they would go through your rectum. And the for sure way is usually by biopsy, where they go and take a sample of the tissue. Once they do a biopsy, the physician will look over the cells, and this is how they'll determine whether or not it's cancerous. If it's cancerous, they'll grade the tumor. That's also how they know how fast the tumor is growing. The higher the grade, the faster it grows, and then the physicians use your tumor grade along with your age for them to decide on which treatment options are best for you. There are various different ways of treatment with prostate cancer. For some people, they might choose active surveillance, and this is where you just watch it. You and your physician have regular checkups and see whether it's growing or whether you should do other treatment options. This is usually done whenever the risk of treatment outweighs the benefits. There's also surgery, which is usually done in the early stages of prostate when they go in and they remove the prostate. There's another procedure known as a TURP, or transurethral resection of the prostate. They go in and they use a cutting tool to remove some of the prostate tissue in that procedure. There's also radiation. They can do external radiation where they give you the radiation from the outside to that area, or they can implant a device to help kill some of the cancer cells. There's hormone therapy where they give you drugs and they may use that in combination with the radiation. And there's also chemotherapy if some of those other treatment options have not responded well. And chemo can be used in coordination with radiation as well. If you would like further information on this, there's support groups. The Cancer Center has a patient navigator. She can give more information on that. You can also go online to www.cancer.gov. I got a lot of my information from the National Cancer Institute. And there's a number, 1-800-4-CANCER, and that's the number 4 and cancer if you want more information on it. Thank you.
Thank you, Tina. Again, some very valuable information that I think we all can use, we can share with our loved ones. Are there any questions? Yes, Tina?
The question she was asking if anything could happen once they remove the prostate gland. Not likely, but you know, once you've already had cancer, it can increase your risk of catching cancer in other areas. Most men, why they don't like to remove the prostate, their issue is because of the side effects, which include impotence, meaning having trouble with erection, and incontinence, meaning they can't control their urine. But a lot of people do have it removed, especially if they find it early, and they live fine. They're usually okay. Yeah. You're welcome. Any other questions? Okay.
Again, thank you so much, Tina, for this wonderful informational piece that you've shared with us today. Right on time, where our next speaker is going to discuss breast cancer, and she'll tell you a little bit about where she just came from. And her name is Michelle Stephenson. Michelle, if you'll kindly come up, please.
Good afternoon, everyone. I'm just coming back from the Susan G. Komen Race for the Cure. I've done it several times, but I got up at 3:30 this morning and volunteered this year. So I have my pink shirt on. I am a 6-year survivor, and I was handing out information about some of the projects that I'm working on. So I went home and I did shower, so I don't stink. So I went home and showered and put my alternate shirt on and my jeans. So it was an awesome experience. It was good and bad. There was more survivors there. So it was bad because it meant there were more people that were diagnosed, but it was good because they were celebrating life. So it was a really good experience for me. I'm going to talk more from a personal experience than more than a clinical side, but I can answer some questions if you have them. Again, I was diagnosed in 2005, so I was 36. So that's not 40 years old, which you really, doctors require you to get your first mammogram at 40. So I was rather young, I would say. What's different about my story is that my mother had cancer at 50 in 1999, and then she had cancer at 54, breast cancer. But for some reason, when I got diagnosed, I was thinking I'm 36. I just was still in shock, although she had had it twice. So I went through, basically it was stage 3, so it had already gone into my lymph nodes. So I had 6 months of chemo. So my hair came out, and my hair was like this before, as Lucia knows, but for some reason I wanted to have long brown hair and call myself Sasha. I don't know what that was about, but this is what I looked like before. Then I had 2 lumpectomy surgeries. They didn't get everything out. They said called margin, so it was a really simple surgery compared to other surgeries. So it just took the lumps out. And then I had 6 weeks of radiation. So it was about 1.5 years, 2 years of, just the entire treatments. And also, because I was HER2 positive, I was perimenopausal, I think. Some of the nurses would know. So I did have to take tamoxifen for 5 years. That's like a kind of a post-cancer. So of course it was like 2 years out of my life, but I just praise God every day that I'm still living. After that, my mother got cancer again in '08, and that's when she died at 59. So since then, I've been on a mission. I started Pink Vision, which is a cause marketing company that helps breast cancer awareness organizations like the Rose, Pink Petals for Pat, Reconstruction of a Survivor, and that's why I was there this morning. And I'm just determined, especially for African American women, we tend to get it, it's more aggressive when we get it. So say you get your first mammogram at 40, you might already be in stage 3 or 4. So that's kind of the difference. We don't exactly know why. There's research that's going on, but some ways genetically we just tend to have a more aggressive gene or a type of cancer. So I just want to say I would encourage everybody here to know your body, do your self-exams every month. You know, and I would encourage if you have any kind of history with a mother, aunt, grandmother, to see if your doctor would allow you to get a mammogram before 40. Because I can count on both hands and both feet friends that I know that are survivors that have had cancer before 40. So I can't stress enough, especially for African American women, how we need to really take care of ourselves, educate ourselves. I do have information on some of the different nonprofits that I work with on how to do self-examination, how to look for different things. Sometimes you can't even find it. It's behind the chest wall. You wouldn't even know. So Pink Vision, what I do is help nonprofits with fundraising, and I have an event that everybody's invited to. It's October 9th, which is Sunday, 1 to 4 at Lucky Strike Lane. So we're going to bowl, we're going to strike out cancer by bowling. So it's free admission, but I just want to collect funds to go to my support group, which is a spiritual support group called Reconstruction of a Survivor. Whether it's $1, $100, or $1,000, we just want to have fun, but we do want to we're going to have an educational piece at that particular program as well. So I do have information about some of the support groups I talked about, and if you have any questions, I'd be more than happy to answer them. Like I said, I'm really informal, so excuse me.
We'd like to thank Michelle for coming out here today. Michelle, this was, again, wonderful information. I think when you hear about those different topics, especially when you're dealing with health-related issues, and none of it has impacted your life, you're hearing information, you may or may not pass it on, you may or not pick up the brochure and share it with anyone. But I'll tell you what, when you have experienced one of those issues yourself, or you have actually gone through this event with a family member, a loved one, I think you have a whole new perspective of what that disease is and what the impact does to someone. Michelle and I have worked together for a long time. I'll just share a little bit at the Houston Chronicle. And when Michelle was going through this process, she worked for me at the time. And she really, she'll let you know that she really was not going through it by herself. And it was, we just had to support her all the way. And I remember her mom coming down. She's from Missouri. I'll talk about you a little bit, Michelle. Her mom, she's from Missouri. And I remember her mom coming down and me meeting this wonderful, wonderful angel of a lady. And she's telling me, she said, Lucia, she said, thank you so much for not even, I knew Michelle had a situation she had to take care of, and I wanted to make sure that work was not going to be an issue for her at all. That's the least she had to worry about. So I made sure I took care of that, and just the fact that her mom acknowledged that, and later on she crocheted, which I still have, a little doily of my name and sent to me. And I mean, that was just so, this was just so, amazing, and it's a woman that I'll never forget, and Michelle, you know that, and this girl has been near and dear to my heart. When I left the Chronicle, Michelle said, Lucia, you're going to have to do something. I've got to go. Who's going to look out for me? So she's doing her own. She's doing a wonderful thing, and Pink Vision is a cause that she has established, and she's doing a really good job with, and we try to support her any way we can, because again, this is something that If it has not affected you, it might be a matter of time. It may not be you immediately, it may be your sister, brother, in-laws, you never know. But somehow there's always somebody that we know that's impacted by those horrible diseases. And I guess we need to all try to see what we can do to overact those events. I think we've gotten a lot of really good, valuable information as what, preventative measures pretty much as to what we can do so as we do not go through those things, whether it be, any of the speakers today, breast cancer, prostate, stroke-related diabetes, or even with Crisis Pregnancy Center, talking about, the young ones. And then we've got two special gifts that I would like to present because without those two individuals, this event would not have been possible. When I was discussing, I met a certain individual at a workshop, an expo at Lee College earlier this year. In fact, I think it was February. And he came up to me, and I was just so impressed seeing how given he was, seeing how he was open, he was friendly, and I don't know, I just thought he was a wonderful person. To you. He said, whatever you need, whatever resources, any of my people, whatever we can do to help, you've got this place, this is it. And I'm going, wow, I have never, usually, you have to go through red tape to get even a location, much less for someone to be so open about you having a dream, you having an initiative, and to wanting to help you make sure that is implemented. So I would like to give a special gift to Pastor Bruce. If you kindly come up. This is from CAHFT. We thank you so much, Pastor.
Thank you very much.
We thank you for everything that you've done for us. Okay.
Y'all have done so much for us. Thank
Yes.
you very much.
Thank you. And the second person that ran around with me, that went to Food Town and went to Kroger's and went to Walmart, and then where else did we go to? HEB, running around with me, going to those individuals and asking for sponsorship, asking for help. And just being there, all I had to do was call, and she was just right there. And we came back, we carried all the water, we brought them in, we put them in the refrigerator. This woman is, selfless. She's just, I don't think there's a selfish bone in her body, and just so giving and such a wonderful, wonderful, warm heart. And I knew Sonia, but I didn't know Sonia like I do now. And I'll tell you what, since working on this project, we've got a bond, and I don't think there's anything we can't do together because we work really well, really, really well with each other. You bring the project on, I think we can make it happen. So, Sonia, if you'll kindly come up here. My new sister. Thank you so much. Thank you so much, sweetie. All right. And with that being said, if you have not all had your blood pressure checked, you still have an opportunity. And guys, remember, we've got some food in the back. And yeah, we've got some food in the back. So kindly go out there and support the vendors we have here. And we so thank you for being here. Thank you for coming out. God bless you all. And don't leave yet. Just hang out and visit and network a little bit. And, again, thanks. Guys, this was awesome. This was the first of many.
We're back here live at the Calvary Worship Center inside of the heart of Baytown with my co-host, Melanie Bates, Melly Mel.
Yes.
This was a great event,
Such an amazing event.
I was really taken by all of the information. As you can see, we sort of have so many things going on here. Before we go ahead and talk about the event, we certainly want to give a tremendous shout out to all the speakers who came out today, all of the experts who came out and share a very vital information
Very important.
with us and all that stuff. What was your favorite topic?
I'd have to say my favorite speaker of the whole day was Miss Hannah with the Crisis Pregnancy Center. She had so much information for young girls, older girls who have nowhere to turn to in a crisis, a pregnancy crisis. There are so many options that a lot of us don't know about. So she gave so much information for girls in those situations.
And in addition to that, one of the main topics, which all of them were great, were the information about the diabetes. And you know, diabetes is a challenge, I'm going to call it. And it's an issue within the community for such a long time. And the striking numbers that we heard today was in regards to 19 million who are now in Latin America and in the Caribbean who have this disease, and the projected 20 million who are going to have it over in 2025. So obviously this was an interesting round of events, information here with the community. And again, for the men, the stress topic discussion with Nathalie Dorsett. Great information about stress and how stress makes you a very unhealthy person.
It does.
Also, we had the prostate cancer. For the many men who are out there, make sure you go out and check yourself out. Get tested, and make sure that you become a more healthier human being by going out and get tested for prostate cancer. And of course, I guess the speech of the day of the event was the breast cancer survivor from mypinkvision.com, Miss Michelle Stephenson, to which, as you can see, we have her banner in our background because this is the type of things and this is the type of events that we certainly want to encourage and push for our community. How was it? How did you feel?
It was awesome. Overall, this was such an awesome organization.
Right.
They did a great job. All the vendors who came out, thank you again. So much information that people, took it upon themselves to receive. Testing is very, very important. We had testing here for glucose and blood pressure. These are very, very important topics in our community. And the more knowledge we have about them, the more prevention we can have.
Well, in closing, we are typically in the middle of parties. We're typically in the middle of festivals. We're typically in the middle of, the Caribbean paradise here in the Gulf Coast. I learned a lot today learn a lot today by listening to the speakers and the experts about the challenges these diseases bring, and of course about being a much more healthy, aware about yourself. So, in closing, what we're going to do, we're going to definitely send out a tremendous shout out to the Calvary Worship Center here in Baytown for being our host for the first annual CAHFT Community Healthcare, and everyone who came out today, from my co-host, the beautiful Melanie Bates, from families who are here, LB Marketing who
Solutions
put together all of these nice things that you see here today. Our president, Lucia Bates, our chairman, Peter Renee, tremendous job for putting all of these things together, and the volunteers who work day and night to have this event. We don't know where we're going to be the next time. We don't know if we're going to be up in St. Lucia. We don't know if we're going to be in Dominican Republic. We don't know whether we're going to be in Livingston. But next time we will see you, it's going to be another event. So from here, from the heart of Baytown, to you guys, thank you once again for welcoming us to be part of your event.
Well, hello everyone, this is Anna. I am here in Houston, Tranquility Park, enjoying the Puerto Rican Cuban Festival, having fun, enjoying the breeze and the music. Thank you very much for your support and for watching the first annual CAHFT Community Health Fair. Now, next time on Carib Scene.
Today we're on the campus of Lamar University, and we're here chatting with members from the Caribbean Student Organization. Let's introduce yourselves, please.
Hi, my name is Denai Gardner, and I'm the president of the Caribbean Student Organization.
Hi, I'm Germinal Paralon. I'm the vice president of the student organization.
So tell me a little bit about the Caribbean Student Association on campus.
Our vision for the Caribbean Student Organization is to get different backgrounds of the Caribbean together to show the Caribbean culture and traits to the Lamar campus. Correct.
That is good. So tell me a little bit about you. Denai, where are you originally from?
Well, actually, I was born in Katy, Texas, but my parents are both from Westmoreland, and my mother grew up in Barneyside, and my father grew up in Darlington. But they just embedded a strong Caribbean culture in me and a Jamaican culture in me. But, I take that very seriously, even though I'm American.
Okay, very good. What about you now?
I was born, raised in Dominica, Portsmouth. Both my parents were from Dominica, and I'm fairly new to the States, but I'm fitting in.
Hanging in there.
Okay.